네, 그럼 이미 무대 위에 올라와 계신데요. 배현민 교수님 그리고 아네타 힉스 부문장님 모두 큰 박수로 맞이해 주시기 바랍니다. Ladies and gentlemen, let's give them a big round of applause.
네, 안녕하세요. 저는 오늘 서울 인사이트 세션의 사회를 맡은 카이스트 배현민 교수입니다. 이제 AI로 건강 증진 방식이 재정이 되고 있습니다. 기존 의료계와 달리 클라우드 기업과 의료 기업이 합병하고 의료 소비자 단체와 IT 기업이 융합하여 의료 데이터와 기술을 바탕으로 새로운 방식의 헬스케어가 이루어지고 있는데요. 오늘 여기에 함께 하신 연사님과 함께 헬스와 기술이 만나 앞으로 우리의 삶의 질을 어떻게 변화시킬지 알아보도록 하겠습니다. 그럼 이제 강연으로 세션을 시작하겠습니다. 이번 연사는 호주 오라클 헬스에서 생성형 인공지능을 기반으로 디지털 시스템을 현대화하는 방안과 그것이 임상 진료에 미치는 영향을 연구하고 계신 아네트 힉스 전략 부문장입니다. 힉스 부문장님은 보건정보통신 기술 분야에서 20년 이상 종사하신 대표적인 디지털 보건의료 전문가입니다. 보건의료 분야의 신기술, 특히 인공지능 도입에 힘써왔는데요. 오라클 전에는 IBM 왓슨이라고 아시죠? 네, IBM 왓슨 케어 사업부의 임상 고문으로 재직하시면서 인공지능 기반의 왓슨 헬스 어플리케이션 포트폴리오 등 보건의료 기술 혁신에 기반한 비즈니스 개발을 지원하셨었습니다. 그러면 아네트 힉스 부문장님을 큰 박수로 모시겠습니다.
Hello. Great. Hi. As was said, I'm actually work for Oracle Health as a strategic client executive. And I'm going to talk mostly about the healthcare and the actual, which was pointed out to me as I was speaking to our esteemed moderator, we're like bookends. I'm actually at the clinical, operational efficiency side with AI, and I'm going to just give a picture of what it's like currently and where we're heading in the future. And our esteemed moderator is actually on the diagnostic side, so we actually like two bookends. So today I'm going to talk about some of the areas of the challenges in healthcare, which people need to understand, or as an audience need to understand if you're not working in the industry, some of those things that actually are what I call factors that inhibit introduction of certain solutions, but also factors that mean that we need to have these innovative solutions to help us solve some of these challenges. I'm also going to talk about some of the future solutions and solutions that we're releasing into the market now using generative AI. And lastly, I'll talk about some of the issues, and I think all of the speakers have talked about today, is that it's not simple as just applying AI to a solution. There's a lot of things you have to think about before you implement into a setting, in particular healthcare. So this is just a forward-looking statement that we make because I'm going to be talking about future products, and it's up to us to let you know that that's what we're doing. So the Oracle's mission is very applicable to all industries. But if you think about the health industry, it has more significance in many ways. Enabling us to see data in new ways enables us to look at new ways to treat people and advance clinical development. Discover insights enables us to look at how do we actually bring actionable insights to clinicians and patients at the right time. And we're looking to unlock endless possibilities in the industry. And Oracle Health believes that we can do that with some of our tools. Healthcare has actually reached I'm finding it very difficult here. Healthcare has reached what I would call a turning point or an inflection. We're actually now looking at how we can actually apply the use of data to the industry to ensure that we can actually gain better outcomes for our citizens. One thing I need people to understand, and I don't think anybody's talked about today, is that a lot of our organisations in healthcare are still not digital. This is what they see as a patient record. It's a paper-based record. And the issue for us is that they cannot participate in the AI era if they're not digitalised. And that is one of the biggest challenges we face in the industry. Large hospitals are, large organisations, but some of the smaller ones haven't actually invested. So let me look at some of the challenges that we face in healthcare. We have a major issue with the workforce, and we've already talked about workforce today and the workforce and AI. But with healthcare, we've got a very major issue with a skills shortage, employee burnout, which seems to have escalated through COVID and got worse, and we have high turnover, which I think has already been referred to in other industries as well. We've got a cost issue. There's rising costs, complex supply chains, which yet again with travel, which COVID really broke, and we're still getting on our feet, trying to actually understand how we continue to have appropriate supply of consumables and requirements for healthcare. Regulatory challenges, which makes it very difficult to provide affordable and high quality healthcare. One of the major challenges is data. Now, many people would say we're swimming in data, but a lot of our technology is outdated. We have fragmented data, siloed processes, which makes it difficult to secure and share data to adapt what we would like in new models of care, be innovative, and have actionable insights from that data. Tools. If you're a consumer of healthcare, you would understand that we do not have intuitive tools. We do not have tools that enable you to track your journey in the healthcare industry. And then the other is inequities. A lot of these challenges create inequities across populations, communities, leading to inequitable outcomes in certain areas. And the data here presents to you some of those really harsh realities. 40% of clinician burnout is related to EHRs. Global healthcare spend is expected to double from 9 trillion to 24 trillion. And the lack of healthcare data interoperability looks to be increasing the cost of US health system by more than 30 billion. And I would say that, hazardous guess, if we went and looked at any other country, we would see similar increased challenges. We need access to healthcare information, and 81% of adults support that increased support. And the one thing that has always been a challenge for me to understand, it takes us 17 years on average to deliver a drug to the market. And we should be able to do that quicker. And our healthcare is more than just an EHR. It's very complex, the system. And what we need to be looking at is ease of navigation, enabling people to manage their healthcare in overwhelming and time-consuming. Cybersecurity. Healthcare records are actually worth more in the market than a financial record, so it makes us a major target. We need actionable data, and we just can't do that at the moment with the siloed systems. Healthcare is also a people business. It's face-to-face. Clinicians actually want to spend time with their patients. And 70% of the providers say an overwhelming amount of data is a barrier to connecting healthcare. And 52% of physicians are actually spend time on EHR and administrative tasks. Rapid discovery. Disease burden is increasing, and we need rapid discovery to actually have the right treatments and be able to manage chronic disease. And lastly, operational agility. One of the things that Oracle is looking to address with their new solutions is the ability to actually have operational agility to make sure that our supply chains are actually automated, other areas such as rostering and management of resourcing automated as well. And any organisation that's dedicated healthcare would have one or two of these areas at the top of their goals and achievement. improve the healthcare worker experience, drive efficiency and lower costs, streamline data processes, equip people to make informed health decisions and choices. This is one area that I think that we need to focus on, is looking at empowering the consumer and also accelerate further research and promote healthcare. The new paradigm. So what is it going to look like for healthcare? And as I said, I'm going to be focusing on operational issues. So Oracle bought Cerner, which is a very large healthcare company, in 2022, and are now looking to move towards an end-to-end view of healthcare. And Oracle Health is dedicated to creating people-centric healthcare experience powered by unifying global data. We are looking to take what Oracle knows best, other industry blueprints, and bring them to the healthcare industry, such as looking at the digital twin from the some industries, such as the building industry, or taking what they do in retail and applying it to healthcare, because healthcare is much more patient or people-focused, and we're looking to be very patient-centric. So unifying the global data will help us to gain new insights and able to develop new treatments. So we're dedicated to changing that paradigm. So how is Oracle Health going to do this? We're bringing together on a single platform Oracle's enterprise solutions, which are well known globally, with the clinical solutions to look at an end-to-end view for a health organisation. That is to be built on an open and intelligent cloud-based healthcare platform where customers and partners can build, test and run applications securely. This is an open ecosystem. We are not closing the door to doing partnerships with other players. We will take the solutions and integrate them into our solutions. Some of the value of that is that end-to-end view. Be able to look at the enterprise from the point of entry all the way through to the end. If we think about some of the processes, supply chain, for example, we can now, with these integrated solutions, look at supply chain from the point of a procedure being scheduled. We are building out the capability using Gen AI as a basis to be able to do that automation of saying, we need these consumables, tracks it all the way back to the purchase of those consumables. And also in a manner that ensures that they're appropriate consumables, that we're not using consumables that are more expensive because other consumables are not available. The Oracle Cloud infrastructure gives us the ability to use Gen AI because it's a hyperscale solution which enables massive compute power underneath the solution. So where are we focused from a strategic point of view? We're looking to empower the front line, and I'll be talking about that later, about the first solutions that we actually have developed, about making sure that the clinician is focused on the patient and that there's less on the computer, which most clinicians have complained about, and it's supported by Gen AI. Engage and delight patients. Interact and collaborate with care teams and staff using modern, intuitive solutions. Integrate the back office, which I've already talked about, which increases the efficiencies. But in increasing efficiency, we unlock funds for other care, which is focused on clinical. And then optimise the system of care by using data, interoperability, analytics, intelligence to actually get the insights. Just a little bit about technology. AI has been around for half a century, and I have to mention this because I'm originally from IBM. Most people would have known or first heard about AI when IBM Deep Blue beat the world chess champion. And then in 2011, and I was working in IBM, Watson beat humans at Jeopardy. And that was when the healthcare industry woke up. That's when they said, hey, AI could be beneficial to us. And now we have started to see AI solutions in healthcare. A lot of them have been in diagnostics, and IBM was looking at oncology, genomics, research, and radiology. And IBM Deep Blue is actually a classic AI, which carries out tasks that humans might carry out and make predictions. So it looks at patterns in the data and then uses that to formulate what is prediction for the new data. But generative AI creates something new. It can use audio, text, and imagery. It can take large, complex, multi-dimensional pattern based on lots of data, and it can actually generate documents, summarise tables, set out new categories, and sometimes, as we've all heard, hallucinate. But it is very powerful. And that powerful capability is seeing this adoption curve. It is rapid. If you can see this 4-year graph, you can see that we're actually looking at it being adopted faster than a smartphone or a PC. So that tells you this technology is quite attractive. And one of the things that Oracle has at its disposal, that we have our AI services built into the platform that our solutions are built on, which makes it natively available, and you're on the infrastructure that enables the compute power to analyse the data. So that's a major advantage. So we are seeing how we embed AI into our technology stack. And the value actually of the end-to-end solution on top of the stack that we're looking at now is about having generative AI services available natively inside your solution. We can do digital assistant, speech and language, document understanding, forecasting, but also machine learning. We can look at the data science platforms, and we have the advanced GPU infrastructure that actually enables us to do the analytics, which is required for generative AI. So AI could be very powerful in healthcare. It can help us change the way we deliver services, the way we treat patients, the way we look at disease, the way we manage populations. And it has that power once we bring the digital data together with newer technologies. Using AI and ML, we can potentially develop new products, new models of care. We can look towards the personalised medicine, which is one thing that everybody has talked about, is the nirvana, personalised medicine. We can also improve care through diagnostics and our life science tools. And the other area, medical devices. If medical devices can actually leverage AI and ML earlier in the client or patient's journey, then we have more impact on their health journey because we're giving them the power of information. And I don't know whether anybody realises Medtronic has a glucose monitoring solution which uses AI to manage and monitor type 1 diabetics to ensure that they stay within a range of different blood glucose levels to ensure that they get a good outcome. And I better hurry up. Oracle has started this journey with a solution called Oracle Clinical Data Assistant. It's all about clinicians and making sure that we actually support clinicians to have a better experience when they're practicing medicine. And our mantra has been empower the front line. Make sure they can practice at the top of their license and focus on the patient and not on the computer. And we're supporting that with generative AI and a modernised solution. So what is Clinical Digital Assistant? It can be managing my day for a clinician, look at all of their scheduled appointments, and also be able to go deeper and look at detailed information about that person. All of this information comes from the EHR. Then it summarises and proposes plans. You can actually get ready for that visit. And it also can take part in the interaction between the patient and the doctor. And it listens and creates notes that then the doctor has to sign off post. So it actually creates a note that a doctor would create. So it takes the conversation, puts it into a form that will be recognised as a clinical note, but the doctor needs to actually sign that off. And one of the things about clinicians is they need to understand that they are the final arbiters of what happened within that encounter. And as I've said, it's the clinical digital assistant, it's a conversational assistant, it's an action assistant, it's a dictation assistant, it's a clinical assistant. We've already released the first version in June 2024 this year into the US. We're currently beta testing it in Australia, UK, and I think Canada. And the reason we're beta testing it again in different countries is that even though medicine seems to be uniform across the globe, all clinicians practice differently, and we need to actually make sure that it meets the requirements of the clinician so the experience is what they're expecting. And we've had some very good feedback from the physicians that assisted in beta testing it in the US about how they felt about the solution and how it improved access to care, enhanced patient and provider experience, and optimised patient, provider and organisational outcomes. One of the ones I really like is that from Dr. James Little, which is saying it's going to be the most important EHA technology update I've seen in my career. And that was saying something for a lot of clinicians. But we're not stopping there. This is our first, but now we have plans from the clinical digital assistant to what I'm calling, they call it PowerChart Desktop Assistant, but it's actually Desktop Assistant, sits on top of the EHR. It's an AI assisted chart companion. And then we'll be moving to the immersive AI-enabled EMR, which is basically AI embedded into the record. Proactive and personalised, conversational search everywhere, and the real interesting part is explainability and source citation, because all the way through here, a clinician can always test where that information came from. They can dig back into the record and get that information. It's all about building trust. Just a bit more about the desktop copilot. This is almost a sidekick. EMRs or EHRs from a nursing clinical point of view in the inpatient environment are quite documentation heavy and a lot of screen searching. So this is all about taking away that friction in enabling a clinician to have one screen using text or voice to interrogate the EHR, to enable them to unlock the information they need at the time when they're caring for a patient or a person. And this was actually built on the fact that we do have this nursing shortage, and a lot of organisations were looking to see how they could implement a solution or something that could actually be supportive of the clinical process for nurses. Some use cases, because these solutions have not been out very long, I've got some use cases where Oracle have already used machine learning in using it. NHS, Business Service Authority, able to save $1 billion, and that is just using the enterprise solutions, being able to see where they reduce treatment costs and save that type of money, and now they continue to use that capability to harness reducing waste and cost. If you stretch that out across the clinical environment, which is where we're going, we can even enhance it even further. So the sort of areas that are being looked at is rostering and resource management, where you can go from the clinical notes to gather the workload, to feed into the rostering system, to also align it to the skills that you have that are inside your HR system to ensure that you have the right skills match, workload is covered, and that's done automatically. It's not requiring any human intervention. The other is, as I've already mentioned, supply chain. Taking it from the point of a procedure being scheduled all the way through to getting the information, getting the consumables from supply. I've already said we do partners, and we had already built, with Nuance, a similar system to our clinical digital assistant, which is a voice recognition transcript solution, which was within the EHR workflow. And that was built with a partner. And as I said, we are actually going to partner because to solve all of the problems in healthcare, nobody can do it alone. We need the whole system to be working together. So, as I said, I wouldn't be being fair if I didn't talk about the challenges we face in introducing AI into the sector. I think we're a bit different to other sectors. We're very risk averse. We have a number of health professionals that have licenses, and there's regulations that they must adhere to. So we have to have a framework that supports that introduction. So I've already talked about compute power. One of the advantages that Oracle Health has, we have the compute power, but not all organisations do. We have a lot of tech debt. We also need the data, and as I said, some organisations are still working on paper. So maybe Gen AI and the ability for us to make frictionless engagement for clinicians might actually help build some of the business cases to digitalise more effectively, because that's been the issue, the business case. I just wanted to mention regulation and quality and safety. We as global organisation grapple with the regulation across all industries, let alone with healthcare. And I think healthcare is struggling in a lot of ways to understand what is the most appropriate frameworks to use in the healthcare industry to ensure that we deliver quality and safe care. Because the mantra in most organisations in healthcare is do no harm. And hence, they're very risk averse. And we still haven't landed on the right frameworks. So it needs a partnership between technology, Oracle, or whatever large player. It needs the governments and regulators, and it needs the healthcare organisations to come to the table and work together to develop those frameworks, because each of us has a piece of the knowledge that enable us to build a framework which is usable. I can also really want to talk about clinical practice. One of the things that's been spoken about over time is a lot of AI solutions may not have hit the mark in actually being effective in what they were trying to achieve. But that's about experimenting and looking at how does it work in the industry. We have deliberately, in Oracle, focused on the clinician experience because we knew it was a major challenge for our clients. But we need to be careful about how we actually introduce it. We need to make sure that it aligns to clinical practice or enables them to actually digitalise their practices in a more safe and effective way, that they trust that information, which is why I talked about the ability to track back to the source so they can see where the information came from. But also, is it applicable to the area that we're putting it through, and is it usable? And one of the things about EHRs, and they complain about, they're not usable. So we need to make sure we don't make that mistake again. Hallucination. We know that generative AI can hallucinate, and we need to make sure that in the industry people understand that, and then it can't take away the clinician oversight. Which leads me to one of the last, which is skills. Two areas that I'd like to talk about in skills is the fact is that many people think about it enhancing the clinician, but we need not to lose the clinical skills in the environment to make sure that that oversight is always being there. Secondly, we need the support skills such as data scientists and clinically experienced technology individuals who can actually support the organisation as they implement their AI solutions. And then there's cybersecurity, because there'd be nothing worse than a bad actor taking over AI solution inside healthcare. So how do we know we've got there? I think we know that it's just software once we get there. And will it have changed healthcare? Definitely. It will change the way we do healthcare, particularly for clinicians and patients. So it's really important that we think about the way AI and generative AI can actually help improve the healthcare industry for clinicians, for our cost management, for enabling advanced treatments, faster development, discovery of things that we don't know today to help us help the world get a better outcome. And as Larry Ellison, our leader, says, and he's got a passion for healthcare, we have a moral obligation to make healthcare better. There are lots of things we can do to produce better outcomes at lower costs. We can do it. If we can do it, we must do it. And I think that's where we land in healthcare. Thank you.
네, 발표 잘 들었습니다. 아넷 힉스 씨께서 그 디지털 헬스 건강 패러다임의 변화라는 측면에서 이제 발표를 해주셨는데요. 그 발표에서는 의료 인력이 부족하고 그다음에 비용이 증가되고 환자 비친화적인 과거의 기술 그리고 건강 불평등 등 의료 산업이 직면한 과제를 언급해 주셨습니다. 그리고 이런 아넷 힉스는 이런 문제에 있어서 통합된 글로벌 데이터를 기반으로 환자 중심 경험에 중점을 둔 새로운 의료 패러다임의 그 필요성을 역설하였고요. 그리고 오라클 헬스의 개방적이고 지능적인 클라우드 기반 의료 플랫폼이 환자와 의료 제공자에게 권한을 부여하고 데이터 프로세스를 간소화하여서 연구를 가속화하는 것을 목표로 개발을 하고 있다고 말씀하셨습니다. 또한 의료 분야에서 AI의 역할, 즉 적용된 AI의 이점 및 고려 사항에 대해서도 언급했는데요. 그 임상 디지털 어시스턴트와 같은 오라클 헬스 AI 기반 솔루션은 의사의 오진을 줄이고 치료 시스템을 최적화하는 것이 목표라고 이렇게 말씀하셨습니다. 네, 그러면은 이제 그 힉스 부문장님과 함께 좀 더 심도 있는 대담을 나눠볼까 합니다. 예, 부문장님, 제가 질문 드리면 이제 답변 부탁드리고 부문장님께서도 이제 자유롭게 질문해 주시기 바랍니다.
Yeah.
좀 전까지 영어로 얘기하다 갑자기 한국말 하려니까 좀 이상하기도 한데요. 네, 일단은 제 첫 번째 질문은 지금 발표를 해주신 내용이 프로세스 이피션시에 대해서 병원 측면에서의 프로세스 이피션시에 대해서 주로 말씀하셨는데 저 같은 환자 입장에서는 병원에서 얼마나 프로세스가 이피션트하게 돌아가느냐도 중요하지만 내가 얼마나 빠르게 정확한 진단 결과를 받을 수 있느냐가 저 같은 환자 입장에서는 더 관심이 가는 상황일 수 있는데요. 이런 부분에 있어가지고 그런 어떤 진단의 정확성과 빠름에도 이제 제너레이티브 AI가 도움을 줄 수 있는데 이런 부분에서 오라클은 진출하거나 어떤 컨트리뷰션을 할 그런 계획이 있으실까요?
Thanks very much. Well, as you can see, we're focused very much on the physician at the moment, but also turning our view to the patient. And I do agree that some of the areas that Gen AI can help in the whole diagnostic space is actually scheduling people more efficiently, for a start, from actually getting all of the information that's required, which is one of the things that like a desktop co-pilot can do, is bring forward information that be in multiple systems that somebody at the beginning of the procedure needs to be able to do the procedure. The second part, I think, and we don't focus on diagnostics. I was involved in diagnostics in IBM Watson Health, so we were focused on the radiology space and looking at using classic AI for diagnostics. But if we look at the Gen AI from a point of view of, it's more of, I see it more of the ability to actually bring information together and come to some conclusion, which was our aspiration with in IBM Watson Health. And the aspiration for Oracle would be to link into other people who do that type of stuff, but support at the top level, which is all about scheduling, supply, being able to actually bring all the information forward when the clinician needs that information to make a decision. Because one of the challenges that clinicians have faced is that they often in the diagnostic space are actually making decisions with limited information. And the more information they have about the person, the better it is for them to make a final decision of using the diagnostic testing. So for example, in radiology, they often had a referral which had chest x-ray, cough, productive cough, and that's about it. But if you had a lot of other information, diabetic, has had previous bouts of pneumonia, blah, 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 they would actually, sorry about that, they would actually have a deeper understanding of what they're looking at. I mean, the alternate side you and I spoke about is using AI to actually analyse the digital images in particular and enable the, help the clinician see abnormalities that they may not see with their eyes because their eyes get tired and a computer doesn't get tired, has massive power.
네, 답변 감사합니다. 그러면은 이번 두 번째 질문은 제가 엔지니어 출신이거든요. 엔지니어 출신이자 제가 이제 몇 번의 사업 창업을 한 경험이 있었고 비즈니스 관점으로 이제 질문을 드려보도록 하겠습니다. 오라클에서 이 비즈니스에 진출하는 거는 오라클이 이제 하이퍼스케일러 데이터 센터를 가지고 있는 회사로서 그 데이터베이스를 잘 다루는 것을 이용해서 헬스케어 시스템에 들어가겠다라는 그런 걸로 파악이 되는데요. 현재 병원마다 그런 어떤 차트를 관리하거나 하는 걸로 병원마다 그 팍스 시스템을 의료 데이터를 저장하는 팍스 시스템을 갖추고 있는데요. 그리고 제너레이티브 AI라는 게 점점 보편화되면서 모든 팍스 시스템을 운영하는 회사들이 제너레이티브 AI를 도입해 가지고 이제 그거를 업그레이드를 시킬 텐데 오라클에서는 그런 경쟁 관계에서 어떤 우위를 가지고 그 새로운 시장에 들어갈 수 있다고 생각하십니까?
Well, I don't think we compete with the with the PACS systems, but the competitive edge we really have is that end-to-end view, that we're able to actually go from clinic all the way back through to enterprise. And when you and I were having a little chat before we joined here, I was talking about the fact that we can actually consume other people's solutions and make them seamless in their interaction with our EHR. So for example, at PACS, we very often integrate PACSs into our EHR so that the clinician can actually access the diagnostic test as well as any of the text-based information that goes with that text. So our competitive advantage is we can integrate anybody's solution into our solution. We do have an end-to-end view. We are offering that, because that's the other thing, we do, interesting enough, work with PACS providers and provide the platform for some PACS solutions that I'm not supposed to know about because it's competitive in some ways, but not that competitive, so that they can have that infrastructure that actually is available to our solutions. So it's a really, I would call it co-opetition in the sense that we do compete often with different players, but very often we come together to build a solution that is actually what the client is looking for. And our competitive advantage there is we're able to integrate fairly easily. Some of the challenges we're having today, though, is, and that was a discussion you and I had a discussion about as well, is that a lot of healthcare organisations don't understand the cloud and what value a cloud infrastructure is to their organisation. And in fact, some regulatory requirements actually inhibit the use of cloud and makes, forces them to build their own private clouds. Oracle actually has a private cloud offering as well, which we can deploy our solutions on. It's not our preferred option, but we do it in a number of countries as well. So we have a competitive advantage because we do have a cloud infrastructure. We can do it on-prem. We can also do it at public cloud. We can integrate with other solutions quite easily, and they integrate seamlessly into our solution, which means it doesn't cause several screens that you have to see to look at information. It actually comes into your single screen. And then obviously we have the AI services within our native cloud infrastructure, so we can deploy those. So the one area which you and I have also spoken about, which I think I need to mention, is the one area that I think we need all to think about, and we have thought about a lot, is how do we offer solutions to smaller scale organisations? Because it is fine for larger institutions that have the funding, but more regional based hospitals, some of the private networks don't have the funds to invest in these new solutions, but they would drive great value for our community. And I was talking about a solution we had in the US, which was a shared domain. And that enabled us to offer solutions at a very lower cost, much lower cost point. And it also meant that they had access to these digital services. One of the things about our solution becoming cloud-based is that it will be less expensive because we don't have some of the building we need to do because it's already built within the cloud. But also it should be able to scale down where we haven't been able to because of cost of the database originally to build the database to put the applications on. Now it's already inside Oracle Cloud infrastructure.
네, 지금 클라우드에 대해서 말씀을 많이 해주셨는데요. 정말 그 오라클에서 만드는 그런 클라우드에다가 병원 데이터를 저장하는 그런 부분이 많이 확산이 돼서 당연히 그렇게 해야 된다고 우리나라 정부도 그렇게 생각을 해가지고 지금 규제가 바뀌었으면 좋겠습니다. 사실 우리나라 아시는지 모르겠지만 우리나라 의료에서는 의료기관 밖으로 데이터가 나갈 때는 다시 사이버 세큐리티라는 KFDA 허가를 또 받아야 되는 그런 문제가 있는데요. 그래가지고 병원마다 데이터베이스를 그 내부에서 구축해야 되는 문제가 있습니다. 근데 그 클라우드를 사용하고 원격 진료가 되고 이런 거 하려면 그 레귤레이션이 당연히 풀리는 게 좋겠죠. 근데 카이스트에서 아무리 얘기하더라도 뭐 식약청은 꼼짝도 안 해가지고 오라클이 그런 걸 잘 만들면 그래가지고 전 세계에서 많이 쓴다고 그러면 아마 또 우리나라 정부도 움직이지 않을까 이렇게 생각해 봅니다. 네, 그리고 그 다음 질문은 그러면은 그 프로세스 이피션시를 위한 굉장히 많은 병원에서의 변화를 말씀 주셨고 그거로 인해서 굉장히 많은 프로세스가 간편화되고 효율화되는데 그렇다면 앞으로는 그런 시스템이 다 구축이 된다고 하면 병원에서는 어떤 능력과 어떤 전문가들이 이제 필요하게 되는 건가요? 그러면은 기존에 있는 인력을 그냥 계속 뭐 70% 없애도 된다가 되는 건가요? 아니면은 그런 시대에 맞춰서 새로운 능력을 가지고 있는 그런 프로페셔널이 필요하게 되는 것인가요?
I think there's a bit of all of that happening. Let's look at one of the areas that hospitals, and this is interesting, the focus of a healthcare organisation is the clinical space. Everybody talks about clinical and forgets about the back office. The back office is actually the underpinning infrastructure to make the actual clinical work easier. So I think what will potentially happen, particularly with efficiencies, automation, we will see in the back office function maybe loss of roles because we'll be able to do that in an automated manner and not need so many resources to do it. But then there is also in different parts of the organisation, I think we need to look at how do we upskill the people in the organisation. One of the areas I mentioned was the actual supporting services for the digital infrastructure in the organisation. We today have a shortage of clinically skilled technology people, and we don't have data scientists that we can actually get into hospitals because they generally get better paid in large companies like Oracle or IBM, or so they head towards those organisations. We need to look at how do we actually have the skilled workforce to support digitalisation, particularly AI. And then with the clinicians, I think this is going to look at how do we actually upskill the clinicians for dealing with AI in their environment so that they are able to make decisions about how AI is being used, plus they understand fully their accountability and responsibility in making sure that the AI is doing what it's supposed to be doing. It's not always right, and I think it's up to the clinicians to be skilled enough to know that if something comes back that it's not correct, that they actually definitely firstly go, I'm not going to use that information, but secondly report it back to make sure you do the changes to the system. I've had experience where I've had clinicians say in a prior life, oh, I just forgot about it. But I said to the person, if you don't tell us that it's not doing what it's supposed to be doing, we cannot rectify what is causing that issue and then ensure it doesn't happen again. So there's a lot of layers for us in the health industry where we need to upskill as well as potentially lose jobs. New jobs, data scientists. New jobs, clinically skilled IT resources. New jobs, clinicians who are absolutely understand AI well enough to incorporate it into their practice and practice in a way that's safe and delivers quality care.
네, 답변 감사합니다. 그러면은 이제 뭐 시간이 많이 남지 않았는데요. 마지막 제가 드리는 마지막 질문으로는 지금 현재 있는 어떤 병원이나 헬스케어 기관에서 AI를 도입하고자 하는 환경에다가 AI를 도입하고자 어떤 뭐 환자나 병원이나 어떤 베네핏을 위해서 AI를 도입하고자 하는 기관한테 어떤 조언을 주실 수 있을까요? 지금 당장 뭐 다들 AI 도입해야 되는데라고 다들 뭐 생각은 하고 있는데요. 어떤 조언을 주실 수 있을까요?
Firstly, do your homework. The challenge is, and one of the things that with AI is that a lot of people dabble in AI and do little bits and pieces. And I think for AI to be effective, it's a bit like how we're looking at it from a point of view of Oracle, is what is the big need where you can actually have an impact inside the organisation. The second part is understanding that the supplier or whomever is actually providing the solution has the appropriate quality solution that will be able to scale for your organisation, because I know you're into startups, but small startup type solutions sometimes don't scale very well when you take them into large organisations. So looking at how you might scale it once it's successful. I always find that taking it in and doing a smaller, I don't like calling them pilots, but test of the solution across individuals who have the ability to test and work with the solution and work through the challenges, because I don't think any solution would go into any organisation without some challenges. You need people on the team who have the enthusiasm to actually work through those challenges so that when it's ready to go out and roll out across the organisation, you have worked through some of those major, what I would call glitches, because the solutions need to be adapted to your workplace. The other is ensure you have the skilled workforce. How do you actually upskill your workforce to enable that successful rollout of the AI? I've had experience in a lot of cases where the organisation thinks that, oh, I just roll the solution out and I forget it. The challenge with any of the digital solutions in healthcare, They continue to evolve, new capability keeps being added, and you need to keep, as an organisation, on top of rolling out that new capability. So, for example, we've released the clinical digital assistant with 2 capabilities. The next release will be 2 further capabilities. You need to actually be able to continue to add new capability. And I think a lot of organisations understand it's an ongoing journey to increase the capability of your solutions. So that means you need to have people who are in your organisation who understand how to roll those solutions out and not be dependent on the vendor all the time, because it's important that you actually help roll it out yourself and then somebody who oversights it. So there's a lot of aspects to rolling out solutions that AI is very similar to any other digital solution. The only aspect is it's much more clinically focused for us. So we have to make sure that the clinicians who are involved are actually enthusiastic enough to work through the challenges of rolling it out. It's not easy, but it can be really fun when it's successful and when clinicians say this is fabulous.
네, 감사합니다. 질문에 잘 답변해 주셔서 감사하고요. 네, 저희 세션은 이제 이것으로 마치도록 하겠습니다. 네, 감사합니다.
네, 알찬 강연과 대담 함께 해주신 두 분께 다시 한번 큰 박수 부탁드립니다.